In today's video, we will review posterior lateral, aka posterior hip precautions after a hip replacement. Welcome back to the OT Minute. My name is Arno. I'm a third-year OT student. There are two main approaches that surgeons take when completing hip replacement surgeries, also known as hip arthroplasties. These include posterior lateral and anterior lateral approaches, also referred to as posterior or anterior approaches. The approach that the surgeon takes determines the precautions necessary to keep patients safe. It's important for therapists and therapy students to help educate and train clients to adhere to these precautions because depending on the approach taken, certain movements may place too much pressure on the compromised or weak area of the hip that can delay the healing process or even dislocate the hip. Always look to the surgeon or attending physician's instructions regarding precautions and the approach used during surgery to ensure you are educating the patient regarding the correct precautions, because there are variations and the surgeon or physician's directions will always supersede the general precautions that we'll go over today. If a client has had a posterior lateral hip surgery, there are three precautions that are common. The patient should not flex their hip more than 90 degrees, the patient should avoid internal rotation of the femur, and the patient should avoid hip adduction, such as crossing their legs or feet. Those are the key posterior hip precautions after surgery. Pretty straightforward and hopefully easy enough to memorize, but let's briefly talk about some key things that we want to keep in mind regarding these precautions. When considering the first precaution, which is that the patient should not flex their hip more than 90 degrees, keep in mind that this precaution is particularly important when the patient is sitting down or standing up, or when completing lower body dressing. Because during these activities, it's common for clients to break these precautions by either bending forward at the hip or bringing their legs up, breaking that 90-degree angle. Therefore, be sure to educate patients regarding modified techniques such as getting into and out of a car, for sitting down on lower surfaces, or for standing up from those lower surfaces, and when completing lower body dressing. Tools such as a 3-in-1 commode with arm supports, long-handled shoe horns, sock aids, reachers, and dressing sticks can be helpful recommendations so that they don't flex their hip more than 90 degrees. When considering the second important hip precaution, which is avoiding internal rotation of the femur, keep in mind that this is particularly important when turning during functional mobility or during transfers, because a patient will be used to using internal rotation when turning. Therefore, encourage extra care to keep the knee pointing forwards or slightly externally rotated when turning their walker to avoid internal rotation of the femur. Now for the third precaution, which is to avoid hip adduction such as crossing legs or feet, keep in mind that this will likely take extra intentionality when clients are completing bed mobility or are sleeping. For example, when getting into and out of bed, clients may be tempted to adduct their affected leg when sliding their legs over the edge of the bed. Therefore, it's helpful to encourage them to go slow and have the client focus on keeping their legs straight in relation to their hips. When sleeping, patients should sleep on their back and, if necessary, use a wedge pillow or a large pillow in between their legs to make sure their legs don't cross or adduct while they're sleeping. Now, I know we just went over all the things that patients should avoid doing. However, it's also worth noting that it's important to emphasize getting up and moving, keeping in mind any safety precautions or things like weight bearing, because movement and engagement in meaningful daily routines and activities is a good thing and can improve patient outcomes if done safely. For more OT related content, don't forget to subscribe to the OT Minute. I hope this was helpful to you. If it was, please drop a like or a comment down below to let me know, and I'll see you in the next video.